I can see you. I'm sending you a request, but I'm not sure if you're able to accept it. Hi. Hi, everyone. Hi again.
Is there something wrong with your internet? Or what?
At this point, I feel like it might be me because you changed your network. I've been switching between two, but I don't know what's up. Like nothing, like
This,
even if I keep it on like two different networks, it's not working well.
there's
Okay.
something wrong with Nagpur's internet. Anshul.
Yes. take jabs at Anshul, yes. So I was going to ask you about your future plans. What
So
exactly are your future
basically,
plans?
um, future plans. First of all, I really want to do something in the field of radiology. Something I want to make a mark, basically. And first of all, I want to like kind of. I have not got a very good exposure of sonography, so I want to do sonography well. And I want to kind of work in a little periphery because I feel that the amount of respect, the amount of value the patients over there give you as a doctor is much more. Plus, they need us more. Like in the city, they have a lot of options, but out in the outskirts, they have less options, and they really need us. So I think I'll work in the periphery, and maybe when I'm like in a stable position, I have thought of at least doing once a week charity somewhere, like for free sonography or some camps where I can actually help people out. So that's one. Second, I told you I want to do FRCR. Secondly, I said I want to do FRCR because I want to get my degree recognized. So if at all I get a good, like I really want to, if I get some good opportunities, I would like to learn new things. But as of now, whatever I have learned, I want to use it in a positive way, and I want to kind of yeah make a mark, do something different.
Don't you like this is like a very different thing that I've heard a radiologist wanting to go to periphery because the main thing that we think about when we're thinking about periphery is that oh there is only an X-ray machine and a USG. So for you to make a diagnosis out of like two modalities where you cannot be sure because
Yeah.
of like obvious reasons. So it basically means you have to get like you have to become like super experts of those, or you have to find ways to give these patients access to CTs and
Actually, Aishwarya, it's not very difficult to like in today's times, people have CT. That's why they always rely on it. Okay,
hmm,
you can make the diagnosis of appendix on a sono, but since you have that at the back of your mind, कि, okay, CT की machine है, so you use that. Nowadays, I have patients who directly just have abdomen pain and they come for CT. Why? You don't have to
hmm,
expose the patient to radiation unnecessarily. Just today, I had a patient who's 13 years old. She has abdomen pain. Why should she do a CT scan? People are not understanding that radiation is harmful. If it is not necessary, you don't give radiation. So this is happening today in today's times. If I talk to my father is also a radiologist.
hmm.
In those times, they did not resort to CT so much, and I yeah.
Hmm, yeah.
So, as much as I've spoken to people, it's not that difficult. Of course, X-ray is difficult. Even I don't have that much exposure to X-ray. But USG, if you really master well, it's not that difficult.
So
Hello? Yeah.
since now that you are independent and earn like you are earning, right? This is a paid degree or you are getting paid for
We're getting a stipend, not exactly paid, but yeah, we
oh,
get a stipend, which is not too much.
so
It's
since
less.
that you have I
Sorry, I couldn't hear you.
I
Sorry.
wanted to ask how are you doing with managing your finances?
Finances, I don't have much. I don't have much of anything. So only
And
thing is,
yeah, I think stipend is like only enough for you to live.
yeah, I mean, that's okay. It's doing good.
Um, who makes you feel grateful? Like who is right now making you feel happy that they are in your life at work? Like who are you grateful for?
At work,
Mm.
um, first of all of my like three sirs, they have been really like, um, they have really guided us. They have scolded us, but they have trained us really well. And I think each and everyone, even here, when we do night duties, there are technicians. So they are also really intelligent. There are many
Mm-hmm.
things which we learn from them. In fact, even they are sometimes good at diagnosis because they keep doing that stuff.
Definitely. I
So
think
all
for
grateful.
me, like whenever I went to interventional radiology, I have learned more from technicians because like just sitting there and like seeing them work through things, it's more like they know about the machine better, I think. Functioning,
Yeah,
not like and
actually, yeah.
have you managed to keep your interest outside of medicine alive? Like whatever you were doing outside of medicine.
Actually, the only like my time was 10 to 9, so the only time that I had was early morning or late night. So the only thing that I
Mm.
could do was gymming because that
You
was the
lost
only
weight, so
time.
that's like plus. That's like good
Yeah,
thing.
kind. Yeah, actually, I wanted to, but yeah, that was the only thing I could went out, like the only thing I could do apart from studying, because it was
Mm.
getting, especially after COVID, everything was closed. There was nowhere to go. It was frustrating. So the only thing was gymming that I could continue. Otherwise, I didn't know much of like things available in Nagpur because it's a new place, like
Yeah,
classes
it's a
or something,
completely
and I didn't have time because I had to manage studies as well.
okay. Do you believe that different kind of people are suited to different professions? Like somebody who has this personality would not go well with radiology or working in radiology.
I don't think so because what you see over time, you develop personalities. You over time learn from things. You learn from your colleagues. You learn. It's about how much you are actually liking that subject. If you like it,
Mm-hmm.
no matter what your personality is, you will blend it. If you don't like it, no matter what you do, it's nothing to do with personality. It's with your interests. If you're liking it, you can do it. Otherwise, you don't.
Yeah,
So
I think
anyone can do
it's.
it.
What about your gender? Do you think it had any effect on you, like while you were getting education and also while working? Has your gender ever been an obstacle or a way, like easy way ahead, basically?
Um,
For
Not really,
example,
actually.
somebody might give you a case just because you're a girl and you asked for it.
No, 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 not at all, actually.
Not at all.
In fact, sometimes when there are things where like a bone biopsy, it requires more advantage. But otherwise, I
Mm.
I don't think so because radiology, in fact, has nothing to do with that. In fact, sometimes when I used to go for night duties at 2 or 3, I used to feel good that oh, I can actually go for it like that. So age,
Uh,
gender, I don't think so has any advantage.
I
I
think
have not
it's
had
like
any advantage.
only a few people experience issues with that. Like, oh, I was not able to get an education initially, I had to fight through it or something. I think nowadays, especially for if you're coming from a place like Mumbai, most of the people would have it easy, and gender doesn't have a lot to do with it. But there are stories of discrimination, so I have to ask, like, oh, is there something there? Okay, how have you been responded to as being a foreign medical graduate? Has the response been anything different, or has it been different from what you were expecting?
Mm, Actually, Like I thought I was really underconfident in the beginning. I thought that people are going to look down upon us and all that. But there are some people who have a really good impression about foreign medical graduates. Like they feel that we really work hard. And when I tell people that I have passed the license exam, they're like, "Oh, acha, okay." Then like, "Okay, okay, you know something, aisa." And the first question that they hello, yeah. So
Yes.
some people think that we are intelligent. Some people do think that we don't study that much. But overall, as far as the course is concerned, the
And what is like a positive thing that you think you had extra as an FMG?
I think exposure, like in terms of like we are more.
I think
Hello.
yes. I'm not sure if everybody can hear you. If someone can tell me if both of us are audible.
So let's ask.
Can you hear us? Yes. So I was asking if you feel like you had more exposure compared to uh, other people.
Exposure in the sense we know like we know many other aspects, like we know about
Mm,
USMLE, we know different with different people, we know the one thing that I think people over here learned from me
mm.
uh, as a foreign medical graduate is that we used to watch videos. So people over
Oh,
here are used to reading books. So I used
yes.
to always watch videos for topics which I didn't understand. So they used to be like, "Are like what are you saying on YouTube? Like how do you understand?" So I was like, I have a habit of watching videos because over there we
Mm,
used to watch cartoons and all that. So that's one thing that people from here took it from us. And I think that was one culture which we used to follow over there. We used to watch videos,
yes. Very
make PPTs.
religiously.
We used to make PPTs, and we have more. I think we are more, confident on that aspects. Here,
Mm,
people are more good with reading books. They are more people
yeah,
read books. And one more thing, which is really good over here, which I heard was they have Viva exams during MBBS, which we didn't have.
I think we
So
had
that is,
during internships, we didn't have.
yeah,
I remember because my teacher grilling me in Chinese in OBGYN, and I was so surprised when I was able to answer questions. So, but it would have been fun to have those during medical school. Like, it would have been really, like, you would have to study for it
yeah.
regardless. Okay,
So,
let's go to some questions that are like yes or no. So it's like a rapid fire. Okay.
okay.
Scrubs or formal wear?
Formal wear.
Water to hydrate or coffee?
Sorry?
Water, yeah, coffee.
Black coffee I have started drinking recently, so yeah.
Very radiologist. It's like coffee and radiology go hand in hand. Okay, sleep.
Actually, I would.
Do you sleep on your day offs or do you catch up, meet people, go out?
I don't have a day off actually.
Really? Not even a
Yeah.
single day?
Yeah, I
Oh.
have Sundays, but then we don't have any day off after nights. So
Hmm.
yeah, usually I explore cafes. So yeah, I go out.
Okay.
I don't
Uh,
sleep.
which one has been your favorite in Nagpur? Nagpur.
Oh, I have seen. I really like Next Chapter Cafe. I like.
Okay. Wait, I'm from here and I haven't been here. I'll go maybe Wednesday when I have an off.
I've been to Villa 167. That's really nice.
I haven't been to both of them. I'm going to ask you to drop these names in my inbox.
I just every Sunday I just Google or Instagram and I go explore.
Mm.
Like,
Okay.
remember in China, we used
Do you
to
like?
study in cafes. Here, I don't do
Yes,
that, but I just.
I'm so frustrated with the culture here. People dress up to go to cafes. I'm like, why are you wearing a whole ball gown to go to a
That's
different
how it
job?
is over here.
Okay, do you prefer morning shifts or do you prefer night shifts?
Now I'm cool with everything, but I think days better. I like my night sleep.
Conversation with patients or conversation with colleagues?
With colleagues.
Okay, thank you so much, Devanshi. For now, I think before I end the conversation, I will recall everything like we talked about, because then the video will be half uploaded on my profile, and I want like the points that you said to come up. So our first question was about why you chose to work in radiology, where you explained that you chose it because of multiple reasons. Like you gave an examination to get into PG, and you thought about multiple things. You just basically eliminated some specialities like emergency medicine, so things you didn't want to do, and ended up on radiology and derma.
Yeah.
And basically, radiology was better for you personally, and you didn't want to wait one whole year to get like a specific degree, since you can just
Yeah.
get recognition by doing FRCS.
Yeah.
FRCR,
Honestly,
right?
yeah.
FRCR. I'll wait for it to reconnect. After that, basically, you told me how your regular day at work was initially. It was mostly you learning how to take history, how to position the patient, what not to do inside a room that has radiation. And now you basically make provisional reports that your consultants finalize. Um, Then I
Yeah.
asked you, like, what I didn't ask you what is the difference between studying for medical school and studying for like postgraduate program. But you did answer that, oh, it's more like now you have to study on your own and it's not more classes based. Although you have a few classes, it's more like you're studying them on your own. And like you said, you're doing these using videos, which is fun. Or do you like radio? Do you like Radiopedia? It's like my favorite website of all times. Like I want to be good enough to be on Radiopedia someday.
Really good, but actually, it's not 100% authentic. So, when you actually study, you have to give authentic sources. So, you
Mm-mm-mm.
also have to refer to books, you also have to refer to other websites.
I
There's another
actually do.
website called
I enjoy their
Radiology Assistant.
lectures. They're really fun. Like when they have some live lectures and stuff, they're really really fun.
Yeah, they're good. Yeah.
And then I asked you about, like, we talked about COVID, like, you have 400 patients on one, like, the first day you were, like, it was just 30 patients, and then on a day, maximum day, you had 400 because people were coming from all over India. So, for people
Yeah.
that are not from Nagpur, Nagpur is like a central place, and it is like a medical hub for central India. So, most of the patients that do not have access to things around will just come to Nagpur, because Nagpur has a very big medical community. It's a very big medical hub for basically Madhya Pradesh and Chhattisgarh, like all the areas connecting central India. And we talked about your female role models, where you said your mom, even though you
Yeah.
both are, she studied alternative medicine and you're studying Western medicine, but still you, like, I think it must have been cool to just learn that, since, like, just see her work since uh,
Yeah.
the start. And then you talked about your consultant's wife, who is a
Yeah.
senior gynec and who did really well. So she like basically even did COVID duties regardless like of her being a senior consultant,
Yeah.
and how she balances all aspects of life. And
Exactly.
that's
Yeah, that's
actually
important.
I didn't ask you what have you been proud of recently? Like what did you do that made you really proud of yourself recently?
So basically, I've done like 2, 3 individual CT guided biopsies of a para-aortic lymph node or a mass. So that was really, actually, I would also like to tell everyone, when I came here, I was actually, um, I don't know, I used to get vasovagal attacks. I used to faint when I used to see blood. So from that to this, it has been a really long journey. I used to get actually scared and faint, but now like I'm pretty okay with it. I'm confident.
What about contrast agents? Like, do you also have to place IVs for
No,
contrast
we
agents,
don't
or
do
do you
that.
have nurses will do
We
that for
don't
you?
do. Yeah,
That's
but
really
yes,
cool.
we
I
have
think
to
that's
watch
like,
for any reaction.
hmm? Oh
We
yeah,
have
you
to
have to watch
watch
for
reaction.
you have
Yeah.
to watch for
So if there are
reactions.
any patients who have reactions to contrast agents, we are responsible for it. We have to act fast in those cases.
But I feel like this is like a thing, like from vasovagal attacks to you going all the way to doing a biopsy. That's like something that I would definitely be proud of. Oh,
Yeah,
and
so
like,
when I came in the beginning, I didn't think that we will have biopsies. So the
mhm,
first day I was about to paint, so I told sir, I think I have taken the wrong field because I don't know if I can actually stand that. So he just told me one thing, that if you stay strong and if you keep getting yourself acquainted to it, you'll get over it. So that actually helped.
that's actually good advice. Like he didn't make fun of you, and he actually
Yeah,
supported you through it. Because a lot of people would
yeah,
just make like, oh, how did you
I
get through
know.
medical school for these many years?
Yeah, exactly.
Since we talked about interventional radiology, I will also mention that we also talked about interventional radiology in one of our 10 sessions that we did. And you told me that now interventional radiology and nuclear medicine all have become different subjects, and you would have to go and do a fellowship or do like a DM in, especially in
Yeah,
interventional radiology, because it's more dangerous and it's more invasive.
yeah,
Then I asked you about your career plans, and you talked about FRCR, and you talked about how you want to do something very um, different than like something good, something different, and you want to work in a peripheral area and provide um, radiological care to them. And we talked about how in periphery there are only USGs and X-rays available, and you talked about how nowadays you see people getting themselves exposed to a lot of radiation over nothing, like over just stomach aches or something that could be diagnosed
yeah.
using a USG. So you feel like, oh, it's very easy for people to get diagnosed regardless of CTs. But so there was that, and then I asked you about. Then I asked you about your stipend, and you said it's enough for you to sustain yourself, but not not big enough so that you have to basically manage your finance right now.
Yeah.
And then we talked about who you are more. I think this we discussed about how I think we did discuss the grateful part, right? Like you're really grateful for your mentors there, your
Yeah.
consultants. And then we also talked about COVID experiences a little. This was supposed to be 20 minutes, but network kind of.
It's okay, but you're really doing a good. I really would like to appreciate you. You're doing a really good thing
Thank
for
you.
encouraging others, for
And thank
helping
you for.
everyone.
Network.
Hello, I can't hear
I,
you. Yeah, sorry.
I was saying thank you for agreeing to talk to us about, because these things are very personal, and I'm not sure everybody would be comfortable sharing their future plans or their financial status. But I think and I was so scared. But now, like talking to more people and talking to women kind of makes me feel proud in some way. I don't know. I just feel like, oh, women are doing like, it's like good, like good professional career women like are very inspiring to me. So I'm talking to you guys. Thank you so much. I think we should leave now.
Thank you so much,
Bye,
Anshulya, and
guys.
all the
Thank
best for
you.
your future. Bye
Thank
bye.
you.
Take care.
Okay, bye. Bye, guys.